What do you think are the most common reasons for hematuria, so blood in the urine? How do patients typically present? The most common reasons include patients with kidney stones anywhere along the urinary tract, often presenting with acute abdominal pain, and also young women with a bacterial urinary tract infection. And there are also older men with an enlarged prostate, known as benign prostate syndrome. And there are many more. Let's group them in an easy way so you can remember them. Hematuria is defined as blood in the urine. How do we know that there is blood in the urine? We can dip a test strip into the urine and see a positive result for blood. When the urine is visibly red and the dipstick is positive, this is known as gross hematuria. However, when the urine is not red but the dipstick is still positive, this is called microhematuria, because the amount of erythrocytes is not enough to change the color of the urine. Hematuria can then be further divided into two types based on the shape of the erythrocytes under the microscope. They can either be normal-looking erythrocytes or strangely shaped, damaged erythrocytes known as dysmorphic acanthocytes. They look a bit like Mickey Mouse, which is why they are sometimes referred to as Mickey Mouse cells. They get this shape by passing through the entire nephron. They entered through the glomerulus and traveled all the way through the nephron. If erythrocytes enter the urine first in the tubular system, they remain normally shaped. That is why hematuria is divided into glomerular and extraglomerular hematuria, meaning every source outside the glomerulus. Glomerular hematuria is caused by diseases or damage specifically affecting the glomerulus. It mainly includes two groups of diseases. First, all kinds of glomerular nephritis. In addition to blood, patients can also present with varying amounts of protein in the urine and may be classified as having nephrotic or nephritic syndrome. The most common cause of glomerular hematuria in this group is also the most common glomerular nephritis overall, IgA nephropathy. Other examples include Alport syndrome and the potentially related disease known as thin basement membrane syndrome. However, keep in mind that glomerular nephritis is considered a relatively rare cause of hematuria. Extraglomerular hematuria is the most common type of hematuria. It includes stones anywhere along the urinary tract. These stones cause mechanical stress and small injuries to the epithelium, leading to bleeding into the urinary tract. Remember, since the erythrocytes have not passed through the glomerulus, they are normally shaped. Infections can also occur anywhere along the urinary tract. The most common examples are cystitis and urethritis, but do not forget prostatitis. There are other reasons. Can you imagine why hematuria should always be evaluated, even if there are benign causes like stones or infections? Because of the possibility of malignancy. A typical patient with cancer of the transitional cells, also known as urothelial carcinoma of the bladder, would be an elderly man over 60 years old with a long history of smoking. However, cancer can also occur in the prostate gland, the ureter, or the kidneys. This brings us to another important concept you need to know. There can still be renal causes of blood in the urine that are considered extraglomerular because the blood enters the urine outside the glomerulus. These causes also include stones and infections. And this also includes schistosomiasis, which is a parasitic infection. Another group includes cysts. Cysts are fluid-filled spaces that develop over time but are actually not supposed to be present in the body. Most cysts are benign though. However, sometimes they can rupture and bleed, allowing blood to enter the urine. Inflammation of the tubular cells and the interstitial space along the nephron can also lead to hematuria. Examples include infections such as renal tuberculosis or autoimmune diseases such as sarcoidosis. Renal cells can also die to ischemia or direct toxicity from certain drugs. This is known as acute tubular injury or acute tubular necrosis. Check out this video over here to learn more about this topic. All of this is only a selection of the most common types of extraglomerular hematuria. Diagnostics include ultrasound to look for stones or urinary obstruction, such as a dilated renal pelvis, which is known as hydronephrosis, or kidney tumors, or changes in the bladder and prostate. Urinary tract infections can often be diagnosed based on the clinical presentation. So pain during urination, known as alburia, combined with specific findings on the urine dipstick test, for instance positive leukocytes. Check out these videos to learn more about the different dipstick fields, and then try our quiz, where we present 12 clinical cases. So what else do you need to know about hematuria? First, blood can enter the urine due to contamination from menstrual bleeding or gastrointestinal bleeding, for example from hemorrhoids. Always remember this in women during the menstrual cycle or in older patients with hemorrhoids. Second, red urine with a positive blood result is known as gross hematuria. However, there are also other reasons for red urine in general, either with a positive blood field on the dipstick or there is red urine with a negative dipstick result. Let's look at the first situation here. Red urine plus a positive blood field can also indicate the presence of hemoglobin during hemolysis or myoglobin during rhabdomyolysis. This happens because the dipstick does not detect erythrocytes themselves. Instead, it detects the heme molecule, which is found in hemoglobin and myoglobin. Hemoglobin is found inside red blood cells, so the test can be positive even without actual erythrocytes being present in case of hemolysis. We can confirm this by looking at the urine under the microscope. 2 or fewer red blood cells per standard field are considered normal amounts. Note that rhabdomyolysis typically leads to darker, more brownish urine. Finally, there are reasons for red urine with a negative blood field on the test. Here, you should think about foods such as red beetroot or medications such as rifampicin, which are used in tuberculosis treatment. Alright, let's summarize. First, do you remember the most common types of hematuria? They are usually benign causes. These include urinary tract infections, kidney stones, or benign prostate syndrome, where enlarged prostate tissue can lead to fragile vessels that may rupture similar to varices. Second, why do doctors investigate every case of hematuria? Because it can be an early sign of a serious disease, especially malignancy in elderly patients. However, not only cancer is possible, diseases such as tuberculosis or schistosomiasis can also cause hematuria. Third, hematuria means the presence of red blood cells in the urine. It can be divided into glomerular and extraglomerular hematuria, based on the shape of erythrocytes under the microscope. Fourth, glomerular causes are typically glomerular nephritis and are often associated with proteinuria and signs of acute kidney injury. Depending on the leading symptoms and laboratory findings, this can be classified as nephritic or nephrotic syndrome. Fifth, extraglomerular hematuria can originate from the urinary tract or still from the kidneys. Causes include ruptured cysts, acute interstitial nephritis, or acute tubular injury. And lastly, remember the different causes of red or reddish-brown urine. Some causes, such as hemolysis or rhabdomyolysis, can also produce a positive blood field on the test despite the absence of actual erythrocytes. Other causes, such as certain foods and medication, can lead to red urine without a positive dipstick result. I hope this video was helpful. Consider subscribing, and I'll see you in the next video.